Okay, so we're gonna be using moldable splint, which is orthoplast. We're using this because it's pliable when heated, and we can shape it into the patient's hand or have like a custom fitting for the patient. Before I heated and cut the orthoplast, I just placed the patient's hand on it, and I just did like a vague sketch just to approximate the size that the splint would be in. So we can use this type of moldable splinting material to immobilize the patient, and we can also use it for support. We'll be doing a ulnar gutter splint. So with this, we're gonna have the patient slightly extended with the metacarpal joints about 70 to 90 degrees, and then have the proximal interphalangeal and DIP joints flex about 5 to 10 degrees. Okay, we would use this for fractures to the 4th or 5th digits or any metacarpal fractures, and then we would typically, if it is a fracture, do about 6 to 8 weeks with the splint or until the patient goes to their orthopedic or go get x-rays or an MRI if needed. Yeah, honestly. Okay, so now that we have it cut it out, I'm gonna go ahead and put it back inside the water. Make it a little softer. You wanna make sure that it's not hot where it's gonna burn your patient. Make sure just cool it off before you apply it to your patient to avoid any burns. So once it's cool enough, we're gonna go ahead and now mold it to our patient since she has either a fracture to her 5th and 4th fingers or her metacarpals. Molded the orthoplast into the patient's hand, making sure that the patient feels comfortable, it's not hot, and then we'll go ahead and flip it this way. And then making sure it's closed up here, it doesn't move, and then you also want to add, if you have any extra padding for the patient, you can cut it out and then add it on the edges so it is not sharp or pokes the patient or like pinches them. And then you can also add Velcro to the splint. That way it stays on the patient and it does not come off. And once they have talked to their ortho physician and they recommend times for use, just have the patient follow that. Either continue using this or discontinue. Once you have your moldable splint that's adjusted to the patient, you would probably use this for acute fractures, either to the 4th or 5th digits or metacarpals. Because it's an acute fracture, the patient would use this for about 6 to 8 weeks, or once the patient gets cleared by their physician or orthopedic. You can use this also to immobilize musculoskeletal injuries. We have soft tissue injuries such as sprains or like tendons. And then it also can help with acute management of injuries awaiting for orthopedic intervention. So the purpose of using a splint is we obviously want to prevent motion. We want to be able to stabilize the area that is being used, and it can also be used for dynamic, so more functional purposes. If the patient is cleared, they can just use this during practice or games, just assisting in like controlled motion. It also can be used to aid in healing or lessen pain for the patient. So the instructions for the patient, is to make sure that they are monitoring if there's any symptoms that arise after the splint has been made and applied for the patient, including like restricted blood flow, if their hand starts to get no color, if there's heat injury, because when you do heat this, it gets really hot, making sure they're not getting burned. Any pressure sores or skin breakdowns. We have infections, dermatitis, neurological injury, if they feel any numbness or tingling or stop feeling their hand. And then, of course, the big one, we have compartment syndrome. These symptoms could occur regardless of how long the splint is put on or used. So always want to educate your patient. You want to apply the moldable splint. If it is a fracture, have the patient wear it 24 hours. They could take it off for to take a shower, but just make sure they put it on right away. So if the patient is instructed to keep the splint on 24 hours, you want to tell the patient to not remove it during the day or during the night. And if they do shower, have like a plastic bag to cover it or some form of cover. That way we're preventing from water going in between and then causing any skin conditions or some form of infection for the patient. Again, if it's for more functional purposes, just for practices and games, just have them wearing during that time. Moldable splint, it's plastic, so the patient is able to wash it, make sure before they put it on that the splint is dry and that their hand is dry.